Thank you very much, Mr. Chairman. Thank you both for your service. I know it comes at great sacrifice. In particular, Dr. Gottlieb is a Connecticut resident. I know the sacrifice that you make to serve our country. Thank you to both of you. Dr. Collins, I wanted to talk to you a little bit more about the All of Us research program. This is a program that designs to build a diverse biomedical data set for the Precision Medicine Initiative, and I'm interested in it because one of the participating health centers, community health centers, that is currently gathering data is based in Middletown, Connecticut. And I think it's great that you've gone out and worked with community health centers because these centers typically serve a patient population that is often underserved in biomedical research. So I just want to put that question to you, which is if you could talk about the importance of having FQHCs as part of this initiative and whether there are plans to expand beyond the current 6 health centers that are right now part of this initiative. Community Health Center in Connecticut is very pleased with their partnership with you on this, and we'd love to see more like them get involved.
My opening remarks, I put up this visual image about how it is that we are seeking to enroll participants in this very bold, largest ever prospective study of health and illness in the United States. And we are inviting people to participate by a variety of means, but one of them is through the community health centers here included in the health provider organizations, because we have a very specific goal here of having at least 50% of the participants in All of Us being individuals that are underrepresented traditionally in medical research programs. And the community health centers who provide care to a great number of people, particularly those in lower socioeconomic situations, are very excited about being our partners, and we're excited about having them as partners. We're starting with the 6 and glad about Middletown as a place that has clearly been very successful in getting this up and going, but that is a pilot to see if we can in fact enroll many more. We aim to launch this project fully next spring. At the moment, we're in a beta test. We've enrolled about 12,000 individuals. We're learning everything we can about how these moving parts can all work together, and it's looking very good.
Great. Thank you, Dr. Collins. Dr. Gottlieb wanted to switch topics to another exciting development out of the Cures Act. This is the establishment at the FDA of the Oncology Center for Excellence, which creates a cross-center team to work together on a variety of products to treat cancer. Just an update on what you've learned thus far from this model, and what do you take into account when you're thinking about creating other disease-specific offices?
Having gone to college in Middletown, Connecticut, I appreciate the shout out,
right.
Senator. So, this is an extremely important effort on the part of the agency. So I appreciate you asking the question. The Oncology Center for Excellence, what we've essentially tried to do is consolidate the clinical portion of the review of oncology products into one combined center. So this was instrumental in our ability to expedite the review of the CAR T products, for example. By consolidating the clinical expertise, we were able to more efficiently look at some of the biologics. We've had challenges fully standing it up, and in all candor, it's related to fully funding it. We believe that this is the future of the agency, though, trying to get these consolidated programs in place, and we're looking to other therapeutic areas we can do this. But I think before we can progress on to other therapeutic areas, we really need to make it work in the oncology setting. So we're looking forward to continuing to try to move this program forward.
Great. Another reminder to us that we've got to give you the funds to implement this act. Quickly back to you, Dr. Collins. One more question, and that is on another part of the 21st Century Cures Act. Senator Isaacson and I worked on a provision that allows for the CDC to collect information on the incidence and prevalence of neurological diseases. This was the Advancing Research for Neurological Diseases Act that Senator Alexander and Senator Murray helped us include in this legislation. Just talk for a second about the importance of having this data on neurological diseases to research done at NIH.
Well, it's incredibly helpful to know what incidence and prevalence is for neurological conditions, particularly a condition like Parkinson's, but there are many other disorders as well. It is challenging and expensive to do that kind of analysis and to do it effectively and to keep it updated. And as I understand it, while CDC was given the charge to do this at the present time, they do not appear to have the funding to carry it out.
Yep. Great. All right. Yet another advertisement to put the money behind the legislation we passed. Thank you very much, Mr. Chairman.